Although the national death toll from COVID-19 has now reached 120,000, the death rate has slowed down. But some of the nation's top health experts are warning of the number of cases surging again. Adele Hurd is on this story.
More than half of all U.S. states have reported a rise in new coronavirus cases. Dr. Anthony Fauci and other health experts will testify before the House today that COVID-19 activity will likely continue for some time, and the infection rate is reported to be rising in 23 states and Puerto Rico. One state public health official in Utah is warning that a so-called surge in new cases could force a complete shutdown. In Texas, the infection rate and hospitalizations have doubled.
We are moving very fast in the wrong direction.
Many Americans are refusing to wear a mask, seeing it as more politics than medicine. And this phone video shows police officers in California escorting a father and his children out of a Walmart after police say they refuse to wear masks. But the Republican governor of Texas is urging Texans to wear masks.
I know that some people feel that wearing a mask is inconvenient or that it is like an infringement of freedom. But I also know that wearing a mask will help us to keep Texas open.
Florida, too.
Everyone will have to be wearing masks in public.
This is a real trajectory.
There is a real consequence to not following rules.
More than half of the new cases are Floridians under 35.
Sick individuals have all stated that they've been around a pub, a bar, an event during the holiday weekend, those types of activities.
More than a dozen Florida mayors are now making masks mandatory. Arizona is also reporting record-high hospitalization rates. With new COVID-19 cases shifting away from older patients to young adults who are less likely to die but are more active, the fear is they could help spread the disease to other people in their area, including possibly vulnerable seniors. Dale Hurd, CBN News.
And our CBN News medical reporter Lori Johnson joins us now with more on this. So what is behind the rise in number of cases we're seeing?
Well, we're seeing the rise in number, particularly, Ephraim, among young people. That's kind of a double-edged sword. So we're talking about people in their 20s and 30s, and in some cases, early 40s. The median age of new cases is 37 years old. And you can kind of sum it up in one word: bars. I know you've never been to a bar, but maybe you've seen pictures. Yes. And there's just really no way to protect yourself at a bar. You're very close to other people. You're talking loudly because usually there's a lot of other music or loud talking, and it's very difficult to wear a mask in situations like that. And so really primarily we're talking about young people at bars, but then also a little bit along those same lines, things like gatherings, parties, and whatnot. So this is good because young people typically do not become hospitalized and typically don't die. We see far and above the people who die from COVID-19 are over the age of 80. But as we talked about so many months ago, we worry about these young people giving it to people who are older. And now that everything is opening back up again slowly, people who are at most risk really need to police themselves. They still need to stay home and away from other people. There's this sense that it's over and everything's done. But those people who are at high risk really need to take care of themselves.
We were talking about high-risk folks for many months. Why are we now seeing young people getting COVID-19? We, at one point, were thinking it's not susceptible. They weren't as susceptible to getting it as older people.
Well, it's testing primarily. I mean, testing has ramped up 100% over where it was just 2 months ago. So now a lot of these young people are being tested, and the more testing there is, the more positive results we're going to see. So this is good news. Now, we do want to point out, though, that while we're seeing a huge increase in case numbers, in some places like Texas and Florida, Arizona, we're seeing a huge decline in cases in the Northeast, in New Jersey and New York. So the overall number of positive cases is up about 5,000 per day. We're talking a country of 350 million people. So it's sharply up in some places, sharply down in other places, and just slightly up overall. Hospitalizations overall nationwide are down, and deaths nationwide are dramatically down. They have plummeted. Thank God for that. And remember, Ephraim, the primary concern way back when in February, when we started introducing the idea of flattening the curve, remember that, when no one knew what that was? The point was to not overwhelm our healthcare system. And at this point, even though we are seeing increased hospitalizations in some areas, there is not a healthcare system in the entire country that says we're overwhelmed. So that's a good thing.
Indeed, indeed. Are some asymptomatic people carrying the disease longer than 14 days? Because we know that 14-day quarantine period people often talk about. Are some people carrying it longer than that?
They really are. And this is what is so frustrating to the healthcare community, because just when you think you know about this virus, it does something that is unusual. And this is what we know about the virus, that most people begin having symptoms about 4 days after they're being exposed, but they're contagious about 2 days. So there's that 2-day window, and this is what we talk about, asymptomatic spread. So the answer to this is just pretend like everyone you come in contact with is positive. So keep your distance and wear the mask. The masks work. This has been shown in study after study. Masks work.
Indeed. All right, Lori, thank you so much for your time. Much appreciated.